Right now, Vermont state officials are preparing to give their regular Tuesday COVID-19 briefing. Let's go live to Montpelier now to listen in.
Joining us shortly. I want to start today by providing a weekly data and modeling update. And following me will be Jenny Samuelson, the Deputy Secretary of the Agency of Human Services, who will provide an update regarding Vermont's vaccination program. And then, of course, Dr. Levine providing his usual health update. Our recent COVID-19 data provides a really optimistic picture for both the coming weeks and also the coming months. In the short term, the steady declines in our case rates give us greater confidence that we're now moving in the right direction in Vermont. And in the longer term, Vermont's strong vaccine uptake means that we're on track to meet our May 1st goal in the Vermont Forward Plan, and we're also on track to have a more normal summer this year compared to the last 14 months. This week, Vermont is reporting 797 new COVID-19 cases, 252 fewer cases than last week, and 435 fewer cases than the week before, when we recorded an all-time high. As you can see, our 7-day case rate is down 24% over the last 7 days. And since April 1st, our case rate is down 39%. All of this occurring while Vermont continues to be a leader in testing per capita across the country. When we look at the cases by age, you can see clearly that the younger demographics that drove transmission at the end of March are now the primary reason for why cases are falling so quickly, with cases among this demographic down 33% over the last 2 weeks. COVID-19 cases are also down on college campuses. Each of the prior 4 weeks, we reported over 100 cases on campus. However, this week we are reporting 47 cases, a decrease which is consistent with the larger age demographic. I do want to highlight an important point. These lower case numbers among younger Vermonters are likely not the result of vaccination. These age groups just became fully eligible, and as you can see from the chart, the vaccine coverage is still relatively low in that youngest age group. So it seems much more likely that the decrease is due to behavioral changes, whether it's being more cautious, following the public health guidance, spending more time outdoors. But we do want to thank younger Vermonters for helping slow the spread as we continue to work to get vaccines to those who are more vulnerable. And also request that they keep it up, because as you know, once we let our guard down, things can quickly move in the opposite direction. Cases have also generally improved across the state, with 11 of Vermont's 14 counties seeing their case rates fall this week, including Orleans, which saw a considerable decrease compared to last week. And even in the counties that did see an increase, those increases were relatively mild. So again, this is painting a very favorable picture. With the recent favorable trends, our forecast paints an optimistic outlook for the weeks ahead, and both the ensemble, CDC ensemble model and the Oliver Wyman model forecast that cases are expected to decline in the coming weeks. We continue to see encouraging uptake of the vaccine among our population. Per the CDC, Vermont remains to be one of the highest in terms of its 65 and older population that have started or completed vaccination, today standing at an impressive 93.6% of that population. And we also remain in the top 10 states in terms of doses administered and the percent of our population that is fully vaccinated. And we continue to remain optimistic about the ultimate percentage of Vermonters who will get vaccinated, as survey data continues to rank Vermont as one of the least hesitant states in the country when it comes to the vaccine, which will ultimately be the key to making our community safer, our economy stronger, and life more normal. Even with the pause in Johnson & Johnson last week, Vermont continues to be on the pace to meet our upcoming May 1st vaccination range, laid out under the Vermont Forward Plan. And again, even without the Johnson & Johnson vaccine, we anticipate having enough supply to meet these targets. So hitting these marks will continue to rely on Vermonters stepping up and getting vaccinated in the weeks ahead. Just look at how important vaccines have been to Vermont to date. Given the higher case rates that we've experienced over the winter, We estimate that 120 lives have been saved by the vaccine to date here in Vermont, totaling about half of all the COVID-19 fatalities we've experienced to date, all because of these powerful vaccines and because Vermonters are willing to get vaccinated. Turning to hospitalizations, we see that the rates continue to be rather stable, with the overall trend decreasing slightly this week. Again, we anticipate that our hospital numbers will fall more significantly once we have fuller vaccine coverage among that 50 to 64 population, which we hope to do in the upcoming weeks. And we're also thankfully continuing to see the impact of vaccines on keeping our fatality rates lower. We are now more than halfway through April, and the number of fatalities is down compared to March, and we anticipate that deaths will continue to trend down in the weeks and months ahead. Across the region, cases and hospitalizations are also improving, with cases down about 10% compared to last week. And every state in the region saw a decrease in its case rates, with the exception of Maine. But generally, this is really the first clear sign that we've had in weeks that the COVID-19 situation is starting to improve in the states that surround Vermont as well, which will certainly be helpful to us in the upcoming weeks and months. Now, at this point, I would like to turn the presentation over to Deputy Secretary Samuelson.
Good morning. I'm Deputy Secretary Jenny Samuelson of the Agency of Human Services. Secretary Smith is taking some much-deserved time off this week, so I'll provide you with today's update on our progress with vaccinations. First, I'm happy to share that yesterday we reached an important milestone. All Vermonters aged 16 and older are now eligible to receive vaccinations. A year ago, we could not have predicted that we would have a vaccine or that vaccine would be available to all Vermonters who are eligible. We are also very encouraged by the robust response to the vaccination program for all age groups. As you know, we opened registration for Vermonters aged 16 to 18 on Saturday, and yesterday we opened registration for the rest of the 16 and older age group. So far, just over 47,000 individuals between the ages of 16 and 29 have made an appointment to be vaccinated, representing 40% of that age group. Turning to BIPOC Vermonters and household members, I'm excited to continue to see the gap close. 18,000 individuals have made appointments and have been vaccinated in the BIPOC and population. As a reminder, you can make an appointment on the state's website at healthvermont.gov/myvaccine. If you are unable to sign up online, you can make an appointment by calling 855-722-7878. Press 1 if you need an interpreter. In terms of our overall progress, as of this morning, 295,128 individuals have been vaccinated against COVID-19. 93,750 have received their first dose of vaccine, and 201,378 have received their first and last dose. We have made remarkable progress here in Vermont. Vermonters are known to stick together through difficult times, and this is just another example of our extraordinary resilience and dedication to doing the right thing. Thank you to all. At this time, I'd like to turn it over to Dr. Levine for a health update.
Thank you very much. I think I will continue the predominantly good news theme. As you've noted, we are starting to see our data trending in a much more positive direction now, with low daily case numbers in the 60s to highs in the hundreds. Our positivity rate has also crept down to 1.5% now. Hospitalizations, as you saw on the slide, are relatively steady. Today, 23, which is a little lower than we've been experiencing, with 6 in the ICU. Fortunately, in the last several days, there have been no deaths, and as Commissioner Pieciak stated, the number remains low so far. I do want to let you know that the reporting system that we use for COVID-19 data is undergoing scheduled maintenance right this second. This will temporarily impact our ability to report cases. This means the data is not available and the dashboard will not be updated today. It will be updated as usual tomorrow, and case information will be assigned to the day that they would have normally been reported. We thank you for your patience as we complete this important work. On another data-related note, Vermont has now performed 1.5 million COVID-19 tests, and more than 372,000 people have been tested. It's really an incredible accomplishment, especially in comparison to the early days of the pandemic, when at one point we didn't know if we even had enough supplies to test people the next day. Now, just last month, we had a high of nearly 19,000 tests reported in a day. I want to thank everyone involved in running Vermont test sites, those working in the labs to process the specimens, and those who work to provide this data. But it is really Vermonters who have helped us to reach this point. Your willingness to get tested and your understanding of why it is so important has been essential to slowing the spread of the virus. Now we're finally in a place where testing is highly accessible, it's still free and easy to do. And with Vermont's new travel policy, which requires a test within 3 days of travel for anyone who is unvaccinated, we expect that everyone will continue getting tested, helping to catch any cases quickly. As always, anyone with a possible exposure to the virus or with a possible COVID-19 symptom should also get tested and stay home and away from others while they await their result. This is how we make sure everyone gets the appropriate guidance to protect their own health, their loved ones, and their communities. I'd like to turn now to a topic that's been in the news, what are called vaccine breakthrough cases. Like with other vaccines, there will be some people who will still get sick, even though the vaccines are working as expected. Because as effective as they are, no vaccines are 100% effective at preventing illness. So there may be some people who get COVID-19 even once they're fully vaccinated, but this is a very small percentage. The CDC has released some new data, and as of April 13th of this year, more than 75 million people in the US had been fully vaccinated against COVID-19 since December 14th, 2020. During the same time frame, CDC received 5,814 reports of vaccine breakthrough infections from 43 US states and territories. As of that last week, there had been 104 cases of vaccine breakthrough in Vermont, which I believe now has been updated to 125. If you look at the CDC numbers, they estimate 0.007% as the rate of breakthrough. According to the national data, these COVID-19 cases were in people of all ages. 45% were 60 or older, 65% female, 29% had no symptoms. Importantly, just 396 people nationwide, 7%, with breakthrough infections were known to be hospitalized, and 74 or 1% died. Now, because this US data relies on voluntary reporting from state health departments, it is likely not a complete picture, and there may be breakthrough cases not identified because some people don't get tested. But it's important to note that these are still rare events. Reporting them gives us a chance to help identify patients and look for signals among vaccine breakthrough cases. Again, and this is key, this is even more evidence that these vaccines are highly effective. and in the unlikely event a person develops a breakthrough case, the evidence is quite clear. This episode will be on the mild end of the disease spectrum. All of this is a reminder of why we need to get the pandemic under control and get as many people vaccinated as soon as possible to lower the risk of spread to anyone. In the meantime, we all need to keep our prevention efforts up, wearing masks, keeping a distance, and avoiding crowds in public until we get closer to that goal. After several months of limited vaccine supply, we are really proud we can now say that all Vermonters age 16 and over can make an appointment. I appreciate all your patience and understanding to get us here. This is a tremendous public health achievement, so if you haven't yet made your appointment, I urge you to make one as soon as you can. This is how we get back our lives together once again. And when you do get that shot, remember to keep in mind that it's 2 weeks after your final dose that your body has a chance to mount its full immune response. It's not much longer to wait, and being fully protected is worth that wait. Finally, here's some good news we can look ahead to in terms of vaccinating the next group of younger Vermonters. Earlier this month, Pfizer requested to expand use of its COVID-19 vaccine to adolescents aged 12 to 15. As you know, the current emergency use authorization originally granted by the FDA is for people aged 16 and up. Pfizer-BioNTech has said its phase 3 clinical trials showed its vaccine was safe and almost 100% effective in younger teenagers ages 12 to 15. The data has yet to be reviewed by independent experts, but if approved, we believe the current timeline might allow us to start vaccinating this age group sometime in May or in June. This will not only help us achieve community immunity faster, but also get these adolescents protected before school begins in the fall. We remain ready to use all the work we've done so far, lessons learned, and critical partnerships to vaccinate these younger Vermonters when the time comes.